Okay, so welcome everyone to this evening, our conversations on ageing. Tonight, our topic is understanding, embracing and supporting neurodiversity as we age. My name is Professor Tracy Comans and I'm the Director of the National Ageing Research Institute, as we know it, NARI. I'd like to start our webinar by acknowledging the traditional custodians on the land on which I'm coming to you from today, the Wurundjeri Woi-wurrung people, and I pay my respects to their elders past and present. I would also like to extend that respect to Aboriginal and Torres Strait Islander peoples across Australia and to any Aboriginal or Torres Strait Islander people attending today. Firstly, some housekeeping regarding Zoom. We're going to be starting with a conversation between me and our guest conversationalist for this evening, Professor Sandra Thom-Jones and Professor Mark Bellgrove, who I will introduce shortly. If you have any questions, you can submit them throughout the webinar using the Q&A function, and we will be leaving some time for questions at the end. Today's conversation will also be recorded and uploaded to our website within a few days. So an email will be sent to all the attendees with that link. At NARI, our work is underpinned by our values, one of which is diversity. We also have a strong commitment to promoting accurate information about ageing and older people, painting a realistic picture that is not overly negative, but also not patronisingly positive. This leads us to tonight's topic of neurodiversity as we age, an area we have found that is largely under-recognised, under-researched and under-resourced in relation to adults and particular older people. We have found in preparing for this that defining neurodiversity poses a challenge, as it is approached from various disciplines with different perspectives. As such, the definition has been described by some as a moving target. It's not our purpose tonight to define neurodiversity. Rather, we will be discussing two neurotypes that are prevalent in our population, autism and ADHD. While neurodivergent individuals exhibit unique variations in cognitive domains such as verbal learning, planning, attention, emotional processing and memory functions, research has identified common challenges in executive functioning, including difficulties with working memory, flexible thinking and self-regulation. These can have significant impact on individuals' health, well-being and quality of life, including feelings of stress, anxiety, loneliness, helplessness, hopelessness, fear of stigmatisation, feelings of inadequacy, distraction, procrastination, and difficulties in communication and seeking help. Additionally, neurodiversity is often associated with atypical sensory processing and information integration, which can affect learning, behaviour, and social interactions. It is only through understanding both the challenges and strengths that scientific evidence can contribute to the development of more inclusive support strategies and resources for the community, health and aged care delivery environments encountered by neurodivergent individuals of all ages, including older people on a daily basis. Tonight, to tackle this topic, we are joined by two conversationalists. Firstly, I'd like to introduce Professor Sandra Thom-Jones. Sandra is an autistic author, artisan, academic and advocate. She's the author of Growing into Autism and Autistics in Academia and a passionate champion for the inclusion of autistic people in all aspects of society. Sandra worked for more than 2 decades in the university sector as a researcher and senior leader, most recently as Pro-Vice-Chancellor Research Impact at the Australian Catholic University. She now works as a consultant providing a range of services for autistic people, as well as professional development, research and consultancy services for education, employment and healthcare providers through her website, Autistic Professor. She's also an honorary professor at the University of Wollongong. Sandra has undertaken numerous research projects in partnership with the autistic community on the experiences of autistic people and the knowledge and attitudes towards autism in the broader community, including research that won the Autism CRC's 2019 and 21 awards for research translation and 22 awards for inclusive research. Thank you for joining us, Sandra.
Thank you.
We're also joined by Professor Mark Bellgrove. Mark is Deputy Head of School Research and a Professor in Cognitive Neuroscience in the School of Psychological Sciences at Monash University. He's also co-chair of Monash Neuroscience, a university-wide collective of over 600 neuroscience researchers. At Monash, he leads a multidisciplinary team studying the biological basis of attention and cognitive control. In 2023, he was awarded the Vice-Chancellor's Prize for Research Engagement and Impact, the development of Australia's first NHMRC-approved clinical practice guideline for ADHD. His program of research is funded by the National Health and Medical Research Council, Medical Research Future Fund, and the Australian Research Council. In 2016, he founded the Australian ADHD Professionals Association, an interdisciplinary group devoted to advancing evidence-based diagnosis and treatment of ADHD in Australia. More recently, he led the development of the Australian Evidence-Based Clinical Practice Guideline for ADHD. Thank you for joining us, Mark.
Thank you.
So to begin our questions for this evening, I'm going to start with a question to both of you. So there's a growing body of evidence suggesting there may be a substantial number of undiagnosed neurodivergent older adults with conditions such as autism spectrum disorder, attention deficit hyperactivity disorder, dyslexia and dyspraxia. What are your thoughts on this and what steps can be taken to address this issue? I might start with your views, Mark.
Okay, thanks very much, Tracy, and hello everyone who's playing along at home. Very happy to be here with you today or tonight, and I also pay my respects to elders past, present and emerging, and to anyone in the audience who might have a lived experience of either ADHD or autism. So look, this is like neurodiversity in general. I guess this is very much a moving target in the ADHD space. Based on population prevalence data, we would expect that around 2.5% of the Australian population would meet criteria for adult ADHD. The expectation is that with increasing age, those prevalence rates will decline. But the reality here is, Tracy, we have very little good data in Australia regarding the precise prevalence of adults with ADHD. And I would probably argue, and perhaps I'm wrong on this, but also dyslexia, dyspraxia, etc. So this is really a big issue for us in Australia, because I guess we're having a dawning recognition that ADHD is not just an issue for kids, but it's a lifelong presentation. And so we certainly have a group of adults who are coming forward for diagnosis. Perhaps they've struggled with issues through their life and maybe never got to the point of looking for a formal diagnosis, but on reaching adulthood, often when, pressures start piling on, you're juggling kids, you're juggling work, the multiple demands, often adults will seek out diagnoses. So, and that can really be at any age. In preparation for chatting to you tonight, Tracy, I went to our network, both of clinicians and of people with lived experience for ADHD, to ask, what their experiences of ADHD in older adults was. And really it covers the full breadth of experiences from clinicians who are diagnosing older adults because perhaps a grandchild was first diagnosed, and then the son or the daughter, and then the grandfather or the grandmother thought, well, maybe this is something that's of relevance to me. So these are not uncommon stories these days in Australia. The real challenge here, Tracy, is that we really have a dearth of clinicians in the public sector who are able to diagnose ADHD. I'm sure many of your attendees joining tonight will know that ADHD in adulthood is not treated at all, really, within the public mental health system. So people wanting to obtain a diagnosis and move on to treatment, that has to happen really in the private sector.
Great. So, Mark, I might stop you there and just let Sandra sort of, get your views on really around the misdiagnosis or underdiagnosis in older adults of these disorders.
So I think the situation with autism is very similar, but in many ways simpler than the situation with ADHD, because what we do know with autism is it is a lifelong condition. So we do not grow out of autism. So we don't have that issue of will what proportion of people who are autistic as children be autistic as adults. That's easy. The answer is 100%. So what we have there is that a lot of adults were not diagnosed as children because of the improvements that have been made to diagnosis, because of the lack of knowledge that was around for a lot of people when they were younger. And so by the time they become adults and start to question whether perhaps they are autistic, which often does come, as Mark said, with people with ADHD, it happens when your children or your grandchildren are diagnosed. The barriers to diagnosis are enormous in terms of lack of clinicians, the cost, because it's not covered under the public health system, but also because we have this perception that autism is a childhood condition, and we have such a lack of awareness of autism in adulthood, what that looks like, and so much stigma and discrimination around autistic adults, that there just isn't that awareness that this is what autism looks like in adults, that adults can be autistic, that many people as adults, even when they start to think, well, perhaps I am autistic, perhaps this is what is going on for me, there is that real reluctance to go and seek diagnosis, even if those services were there, because of that stigma, because of that lack of awareness in the community. And if they do make that step, how do I actually go and access those services? How do I access those resources? So there's a whole range of barriers to actually identifying that you are autistic and then going and getting that diagnosis.
Yeah. And so would one of the barriers from both of you be that, is it often pediatricians that are diagnosing these things in childhood, and that other specialties may not have adequate experience or understanding of the adult presentation or the actual conditions in order to be able to diagnose effectively?
I think that's a huge issue, particularly, in the case of autism, it was originally identified as a childhood condition. The early DSMs actually defined it as infantile autism. It was a condition that was considered to be a childhood condition that children grew out of. And I think a lot of that still hangs around. In Australia, under Medicare covers diagnosis for children. It does not cover diagnostic services for adults. And we still need a lot more services for children. I'm not disputing that we need that, but the services, the research, the resources, everything is very much focused towards children.
Yep, great. Mark, as a renowned expert in cognitive neuroscience and clinical neuropsych, could you share your insights on the current understanding of ADHD in older adults? And one of the things you said initially sparked my curiosity around the 2.5%, but that you'd expect to see that there'd be a lower prevalence when people get older. And I didn't quite understand why that would be the case.
Well, I guess that's been the conventional wisdom, Tracy, that with time, as Sandra suggested, that the conventional wisdom has been that people do grow out of ADHD. We know that that's not the case for the large majority of people. And the extant data would probably suggest that 60 to 70%, maybe even more, will carry ADHD throughout their life. I guess part of the rationale for me saying that is partly because there would be many adults in those older brackets where ADHD would be undetected at the moment because of the history of ADHD diagnosis. So your question was around ADHD and what we know about ADHD in the older adult. And, it's a little bit shameful for me to admit this, but we know remarkably little, Tracy. And, when we prepared the ADHD guideline that was approved by the NHMRC, we certainly had ADHD in older adults on our radar. But when we did the literature search, reviews, etc., there is remarkably little data out there from empirical studies. So this has been identified.
Oh, I think Mark may have frozen.
There's a lot of anecdotal.
Yeah. Thank you, Mark. Sandra,
have you got me?
Yeah, we just missed, I think, just a couple of words there, but
Lots of anecdotal evidence.
Yeah, lots of anecdotal
Back to
evidence. Not a lot of hard research has happened in this space. So it's mainly been focused around that younger age group, pediatric adolescents, young adults. Yeah. Sandra, given your extensive research and advocacy and personal experience, how do you see the intersection of aging and autism? And what do you think are the unique challenges that older adults with autism face as compared to the younger population?
I think there are lots, but because of time, I'm going to focus on just a couple. The first one is one of the questions that a lot of people ask me is, I seem to become more autistic as I get older. Why is that? And I think that's probably a challenge for a lot of people. We don't become more autistic as we get older, but what happens is most autistic people have experienced a whole lifetime of having to mask, of having to hide all of the autistic aspects of their entire existence, because there are so many things about the way that we think, the way that we talk, the way that we just exist in the world that we're taught aren't like everyone else, and you have to hide that. You have to pretend to be a neurotypical person. And that has significant physical and mental health impacts on people. That really, it does lead to long-term health impacts from just that pressure, that exhaustion, the cognitive load. It leads to burnout. And so as you become older, that becomes harder and harder. So people find that as they get older, they're losing that capacity to really hide that. And so they start to feel like, is it becoming more obvious? You know, is my autism becoming more obvious? And it's just that they're being really worn down. So I think that's one thing. But I think another thing that we found in our research with older autistic people is some of the things that are common in autistic people and are common in older people, and you merge those two things together. So when we talk about things like social isolation, we know that older people often feel excluded from the community, are often isolated and don't have those connections. We know those same things for autistic people. We know that there are often communication barriers, you know, the inability to make those close connections. And so you've got that double problem there where a lot of autistic people are already isolated. They're already missing out on those connections. They don't have that sense of community. And then you have that aspect that's also part of becoming older. And I think that's particularly difficult for our current older generation of autistic people who weren't identified as autistic when they were younger. So they haven't had that ability to connect to the autism community either. So they're getting that late diagnosis. They're finding out much later in life that they're autistic. They haven't built those networks in their own community that younger autistic people have. And so they're coming into older adulthood trying to make a sense, who am I? Who am I as an autistic person? I realize that I'm different to other people. I realize that I have sensory needs and social needs and communication needs, but I don't have those connections and I don't know how to form those connections. At the same time that everyone is aging and finding that they're moving out of the workplace, moving out of those other situations. So I think it's a really complex space to be in, being aging and being autistic. It can be very isolating.
Yeah, it does sound like a kind of multiplier effect for some of those things around ageism and so as you say, the social
two
isolation.
Groups of people who experience a lot of discrimination and a lot of stigma, and you put both of those aspects in one individual, there's a lot of really negative things that people are going to be getting from the community, and a lot of things that are going to make it really difficult for them to connect and interact and feel welcome and feel included.
Yeah, thank you. Marka, I'm wondering if you can elaborate a little more on the cognitive and neurological changes you might expect with people with ADHD as they age. And I know a lot of that research would be with younger people as they sort of entering adulthood, but, you know, thinking about, you know, what's the physiological basis and what would you expect to see? You know, how might those changes present and what should we be aware of?
Yeah, look, I think this is a little bit, I guess, hand wavy in a way, Tracy, because as I said, we lack data. But if you think about what is going on with aging, where you might have an increase in subjective memory complaints, where you might have, you know, a slow or gradual, rather, you know, decline in functioning of memory structures such as the hippocampus, but also areas of the brain such as the frontal lobe. that help us control, inhibit behavior, act appropriately, plan. All these same structures are implicated in ADHD across the lifespan. So when you think about the aging brain, it does in many ways overlap with areas that are implicated in ADHD. And so one of the things in preparation, I guess, for chatting to you tonight and talking to other people, you know, a common, I guess, concern of people is that their family members might often say, oh, mum or dad, I think you might be dementing, where in actual fact, it might be issues relating to their ADHD or their fact that they perhaps haven't had those issues or complaints treated properly throughout their lives. So memory complaints, for example, are very common. Problems with working memory, executive function, all these things are very, I guess, convergent across both aging and ADHD. So teasing these apart becomes very tricky, right? And I think for people presenting in older life who might have some memory complaints and having chatted to neurologists and psychiatrists, disentangling these can be very tricky. And, you know, I think it underscores why we need greater awareness of how ADHD could present in older adults and more training for example, psychogeriatricians in ADHD and what that might look like. Because for many people, stimulants might be quite beneficial in helping them with their cognitive performance in older life.
Yeah, and it's really interesting and fascinating because I've got a physiotherapy background, but I've worked in research in gerontology for a lot of years and with a lot of geriatricians. And I guess the neurodiversity thing has not really ever come up. So yeah, I think it is definitely awareness raising and an area that we really haven't had a good handle on. And as you say, a lot of mixed things, and Sandra as well, that you have these mixed effects that may be difficult to tease out. Is it the neurodiversity, or is it, you know, some aging or something else that's going on?
Yeah, so I think this is an example for me, Tracy, where the lived experience of people is really ahead of the science and the reports that we're getting from, you know, families and individuals is really ahead. And this, for me as a researcher, it provides, you know, great fuel for new and interesting research. But of course, it means we're playing catch up with the science.
Yes. Sandra, I'm wondering how society, including health and aged care providers, how can we better support older adults with autism, and what changes might need to be made in those systems to ensure needs are met?
I think this is a huge area and a super important area. So if we start with health, we know that the healthcare system is a huge issue for autistic people. Firstly, a lot of us have trouble with interoception, so understanding how I feel. So when I have a symptom of a medical condition, to try and really understand how it is that I'm feeling, and then to be able to explain that to a doctor in a way that they understand. And because of any communication challenges that I may have, to explain to them how I'm feeling, and for me to then understand what they're explaining to me. So there's a lot of those communication issues. Then as we age, we're going to have more complex health issues, and we're going to be trying to understand what's happening with our bodies, explain that to our doctors, understand what they're explaining to us in the context of very limited understanding of our healthcare practitioners of what it means to be autistic in a very rushed healthcare interchange, because it's always, you know, you've got 5 minutes, you come in, and I'm trying to explain how I feel. And many, many autistic people experience this, where you try to describe your symptoms and they ask you questions in a way that's not the way we communicate as an autistic person. We don't understand the question, we give the wrong answer, and so we're sent away without a solution to our problem. So, you know, I think that's a really huge issue for autistic people, plus the fact that the actual setting is often awful. You know, you're in this brightly lit room and it's noisy in the waiting room, and then you're going to see the doctor and it's very bright and there's shining lights in your eyes, and it's, they may be very understanding of the autistic child who's not coping, but really not aware that the autistic 50 or 60 or 70-year-old person isn't coping with that sensory environment. So I think there's a lot of things we could do around really looking at, can we make more sensory friendly healthcare environments? Can we give autistic adults a little bit of extra time to really listen to them and understand what's going on for them? Find better tools that actually enable them to communicate. Please describe your pain to me on a scale of 1 to 10 is a terrible, terrible question to ask an autistic person. I cannot do that. So, I think those things, having better tools, better procedures, if we're talking about things like aged care, really starting to understand what is an autistic person's life like. We don't like change, for example.
Yeah.
So putting us into an aged care home is an even bigger trauma than it is for anyone else, because we're being asked to change. And then, if I then have to eat different food and sit in a room that's a different color and have different furniture and, socialize in a way that's not the way that I feel comfortable. So there's just so much we really need to understand about that autistic experience. And we started to understand it at the sort of preschool and primary school age, but then we forget that all those same challenges continue throughout life. So if we're going to provide appropriate healthcare for autistic adults, it should look in many ways like appropriate healthcare for autistic children. If we're building appropriate aged care, we could start by looking, well, what does appropriate childcare look like? And then actually talking to autistic adults about what aspects of that need to carry over. What do you need to feel safe and comfortable in a healthcare situation, in an aged care situation? Not just assuming because you're a sick elderly person or an elderly person looking for a care home that you're going to be like a neurotypical person and that's going to work for you, because it isn't.
Yeah, so it sounds like there's a lot of work to be done really in co-designing with people with lived experience to understand, their journeys and
a huge amount of
work
work
hasn't not been done.
It has not been done, and that co-design is so important because, we're talking about people who have, in most cases, spent a lot of time creating a life and an environment around themselves where they can kind of get home and get away from that world out there that's so crazy and so overwhelming. And I get into my own space that's safe. But as I get older and I have all these health conditions and all these other issues, I have to go out of my space to access those services. But if those services are so intimidating and so scary and so unsafe for me, I will just stay home and I won't access those services and I won't get the supports that I need.
Yeah, absolutely. Mark, I'm going to go back to you. I'm going to change tactics a little bit, talk about the use of medication. That's been considered quite controversial sometimes, certainly by the media in managing ADHD. And I think, sometimes it's something parents have struggled with in terms of, wondering whether this is the right way to go. When we think about older adults, are there particular considerations around medication use in that age group for the symptoms of ADHD?
Yeah, look, Tracy, it certainly is a topic that captures the public imagination and certainly the media. And I think in many ways that's misplaced, because ADHD medications are very safe and really give a lot of quality of life to folks living out there with ADHD. In some cases, they're not just life-changing, they can be life-saving. So I think we need to look at the evidence regarding safety, which is very good. In older adults, stimulant medications, for example, that are the mainstay for ADHD, are used pretty extensively and well tolerated. Even to the extent where ADHD medications might be administered within nursing home settings. So there's no particular consideration, particularly if the person has been shown to be tolerant of those medications in the past. So I think it's an example where, you need to take a little bit of the heat out of the debate and look at the science and look at both the efficacy profile of the medication itself as well as the side effect profile, which is very favourable.
Yeah. So it sounds like to me that you're saying that it's probably underutilised. in the older population? It sounds like that you're saying it's probably underutilised in the older population, you know, due to concerns. Yeah.
Undoubtedly, and I think also because just the rates of diagnosis in older adults will be lower. Therefore, the use of medication will be be lower. I guess another point just to flag, Tracy, which we haven't touched on, but is a very live issue, is particularly in women, is the use of medication and the ADHD.
I might get
through menopause will report that they're.
Mark, we just lost you for a second. If you could just repeat that last sentence, because we just had a little. Yeah.
Sorry, that's probably my connection, I think.
Yeah.
I was just referring there to the effectiveness of medications in and around menopause, because many women will report that the medications either aren't as effective or their actual ADHD symptoms are worse during those periods of their life, which again is another area where we need much better data. There are well-known interactions between dopamine and estrogen, but in what ways menopause might make the medications less effective is not known, or the symptoms exacerbated during these phases is not known. So it's another really area where there's a lot of intensive interest at the moment.
Yeah. And obviously another time of life where there's lots of other symptoms that go on that also, may interact with neurodivergent conditions.
Exactly.
Sandra, autism obviously doesn't only impact the older person, it also affects their families, friends, and caregivers. Including, when we say caregivers, we mean, formal caregivers that might be paid to come into the home and give care, or in that residential care setting, but also informal caregivers. But what resources and guidance are out there and available to support these networks? And where do we need to have further efforts focused where we're missing information?
This could be the shortest answer to any question, because I could say virtually nothing. But I will expand on that. There's very, very little out there. As we've talked about throughout this session, there's minimal research on the experiences of older adults. There's really that big gap there. And so the same thing happens with resources. There's a lot of resources out there to support families in raising autistic children. There's starting to be more resources around autistic teenagers. There's a little bit around supporting autistic adults in the workplace. But really, when we get to that older adult population, there is a real dearth of resources. There are some books that have been written by autistic people. Obviously, I've written a book which is not specifically focused on adults, but on older adults. But as a person myself who is in my 50s, obviously that's kind of my focus, is what it's been like for me as an older person. There are other books like that are sort of, memoirs or explainers written by autistic people. But in terms of actual resources that are specifically for families, for caregivers, for service providers, there's a real gap there. And that's something that I'm personally really passionate about, and something that I'm working on in my consultancy, is working with organisations around how do we actually develop those resources, because I think we need those for all kinds of individuals and groups. So how do I support my aging autistic family member who's moving into aged care? How do I support them living in their home? How do I support them in accessing appropriate healthcare? How do I support them in interacting with government services? One of the things that we found with the research that we did with older autistic Australians was the disturbing number of them who told us things like, I don't know who to go to if I need support with housing. I don't know who to go to if I feel like I'm being bullied or victimized. I don't know who to go to if I need support with financial things. There was just this absolute lack of knowledge of where to go for help, where to get resources, because this is a really ignored population. So to me, there is this absolute desperate need to provide resources for older autistic adults, for them themselves, around how to interact with all these services, what's available for you, how to live your best, happiest, healthiest life, but also for their family members and also for service providers who are aiming to support them, because the knowledge of the experience of older autistic adults is absent across so many different service providers, organizations, individuals, community groups. It's just not there. So I think there's a need for resources in so many aspects of how do we support older autistic people.
Yeah, absolutely. I would absolutely agree. And, you know, having worked in health and worked in the community sector, and you know, and it's only really in developing this conversation piece this year that I've thought a lot about it. And, you know, really there's no resources, and services often just you know, they treat the average person, and anyone that's not average doesn't do very well because you know, it's just not really catered to differences. So yeah, absolute area of need, and certainly a lot of focus going forward. So finally, speaking about that, my final question to both of you, and I'll start with you this time, Sandra, is what do you see as the most urgent research questions in the field of ageing and neurodiversity that we need to tackle in the immediate future? So I guess if you were going to prioritise and give your top three, like what would you really see as the key things we need to get a handle on?
This is something I've thought a lot about, because we did a review recently of what research has been done around autism and ageing. And the research that has been done typically has focused on the very scientific aspects. You know, what happens to autistic brains as they age, you know. So to me, what really needs to be done is what actually drives autistic thriving in an older age. What are the things that contribute to making autistic older adults' lives positive? What do autistic people want in their lives as they get older? What do they want in the services that they would access? What do they want in their physical and social environment? Because we actually don't know that. You know, we make assumptions about what healthy aging looks like for autistic people based on what we know healthy aging looks like for non-autistic people. And given that we now know quite clearly that what's a positive experience for an autistic child in school or a positive experience for an autistic person in the workplace is very different to a non-autistic person, I think that's the huge gap. Because if we are going to go forward and say, let's build more inclusive communities, let's build better services, then the critical research gap really is really properly informed research with older autistic adults about actually, what do you want? What does quality of life look like for you? What do you need to be happy? What does that look like for you? What do you want in your home, in your community, in your environment? What does success look like for you to live a happy, fulfilled life as you age? We don't know that. And until we know that, we can't really make sure that we're providing it.
Correct. We can't design our services around something we don't know. Yeah. Mark, what's your thoughts on the top priorities now?
Yeah, well, much like Sandra, I think the first thing we have to do is actually ask older Australians with ADHD what their experience is, because I'm not aware that we've done that yet in a true co-designed or participatory research sort of framework. So I think that's the first part, is actually work out what their priorities are, either in terms of their unmet needs, but also in terms of their research priorities. Off the top of my head, you know, having not asked that community explicitly in a very formalized or rigorous way, you know, I think there are definite needs regarding skilling a workforce. It's not a research question per se,
Yeah.
but bringing awareness of ADHD in older adults to all the different professional groups that might intersect with them, whether it be, you know, nurses, OTs, you know, geriatricians, adult psychiatrists, etc. I think that's critical, and dispelling some of the myths that, you know, ADHD is just a child presentation, and bringing to their awareness that, and even with neurologists, that the person in front of them, you know, might be having a part of their presentation, maybe ADHD, and they should put that on their radar and do an assessment for that. I think there are lots of research questions that can be pursued with Australian women with ADHD, because again, it's an area where we're hopelessly underdone in terms of our research knowledge. And we have lots of women presenting as adults for diagnosis and treatment. So I think they're, super important things going forward. But, we need to ask, I think, Tracy,
Yeah, fantastic. And yeah, I guess with, these conditions that were previously, in the history thought to be very much male dominated, and we know that that's not true, and it's just different presentations, and so yeah, I can understand why that they're looking at women particularly is needed. We're actually going to open to questions for the floor now, so please use the Q&A function to submit your questions, and if it's a question for a particular speaker, if you could mention that so that we can direct it. But the first question I'm going to ask that's come in from JK is probably for Sandra, I would say. It says, individuals can grow into ADHD rather than grow out of it. Could the same be said for ASD?
I love that question because my first book is called Growing into Autism, because I actually think that's absolutely true. And I'm not sure if this is how you meant the question, but to me, I actually think that is what happens to a lot of us who have gone through our early stages of our lives, having to hide and mask all of the autistic aspects of ourselves, and have grown up thinking there's something fundamentally wrong with me as a human being because I'm not like these other people. I don't think and act and behave and respond like these other people. And you get an autism diagnosis, or you come to realize you're autistic, and actually start to accept yourself, connect with the autistic community, and start to realize that actually you're not a flawed human being, but actually you have a whole range of strengths. And I think that's a really important part of the conversation around autism and around neurodiversity more broadly, that actually we have a lot of strengths. And that's one of the things that I often say to people. A lot of the things I have achieved in my life are because I'm autistic, not in spite of being autistic. And to me, that's a big part of that growing into autism, is about starting to understand the things about being autistic that make you different, some of which are challenges, some of which are strengths, but actually becoming comfortable with yourself, accepting yourself, taking that mask off sometimes, and actually letting yourself be you, and acknowledging that that's okay, and being comfortable with yourself. And that's one of the most amazing things that can happen, I think, as an autistic person, because it is actually life-changing. And I think that growing into yourself is a really important change, and something that I hope every autistic person gets the opportunity to do.
Fantastic answer, Sandra. And I guess it comes back a little bit to the things we were talking about in the beginning, that if you were diagnosed very late, you might miss that opportunity, which is why it's critically important to have that diagnosis and that support. So probably a question for either of you, but we might say, Mark, what would you be your perspective on any increased sensitivity to the impact of climate change on the health of neurodivergent adults now into the future? So I guess if I was going to rephrase that, would there be a difference in coping that you might see?
Well, I guess, my knowledge of that space, Tracy, is, I guess, most.
Oh.
And insofar as folks with.
Mark, you've frozen a little bit on us.
Issues with anxiety.
Mark, sorry, Mark, we missed
there?
a bit of that because your connection is sometimes breaking up a little bit.
I'm sorry.
Yes.
Look, I was just saying my knowledge of that sort of climate change literature and its impacts on mental health is mostly around anxiety. And to the extent that folks with ADHD or autism can have coexisting anxiety, then I think, climate change folks who are in the neurodiversity community.
Yeah.
Explored in a meaningful way.
Thanks, Mark. So I guess to both of you, do you know of other Australian university researchers or researchers generally that are focused on neurodiversity and ageing?
I don't know specifically of Australia. There are some Australian researchers in that space. Given the small number though, I wouldn't limit people to Australian. If you're really interested in exploring that space, my recommendation would be look at the journal Autism in Adulthood, which is the top journal in my field, and is specifically focused on adults. So anyone doing research and publishing in the space of aging is going to be in that journal. So I would say if you're looking to see who's in that space, who's doing the most topical research, and also there's a very high prevalence of autistic researchers or people collaborating with autistic researchers in that journal. So to me, if you want to be up to date on what's happening in that space, that's where I would go. I would see what's happening in that journal.
Yeah. So we've got a couple of questions which cover the same theme, and it's about risk of dementia. So one directed at Mark, speaking about a couple of journal articles, which I may not, Levine 2023 and Dobrosevic 2022, about the correlation between untreated ADHD and increased risk of dementia. And Anita's also asked about, because Sandra, social isolation is very common with autism and also a risk factor for dementia. So I guess, has there been any looking at the correlation between neurodiversity and increased risk of dementia, or any thoughts around that topic?
I'm not familiar with those two articles, Tracy, that your audience member has posted about, but it's very much a moving target, I would say. Certainly in terms of social isolation, in to the extent that we know that greater engagement with social activities, etc., as one ages, promote cognitive reserve, etc., and can be, pro-cognitive in that sense. So social isolation, I think you could probably understand why it may not be that great for cognition. Engagement with activities, engagement with pursuits that are intellectually challenging are known to support cognitive functioning in the aging brain. So that potentially might be a challenge if people are not wishing to or feeling able to get out and engage in that sense. That's more coming from a literature on the beneficial effects of enriched environments and cognitive reserve for the aging brain than it is from a neurodiversity background, though.
Sandra, do you have any, sort of views on the social isolation and some of the other aspects that may increase risk of dementia, and what might be done to improve that for older adults with autism?
Like Mark, I'm not an expert in that space, but I will say that we do know, as I mentioned earlier, that autistic people are more likely to be socially isolated. If we look at things like the rates of autistic people who are not in employment and not in higher education, they tend to be higher than any other group in the population, so higher than people without a disability, higher than people with other forms of disability. That's not around capacity, that's around marginalization, discrimination, stigma. So if you're talking about a group of people who are fundamentally excluded from society, and as I mentioned before, people who are diagnosed older probably don't have those connections to the autistic community, you've got a real potential there for people to be very isolated. So, my number one thing would be if we could address some of that stigma and some of that discrimination and actually make society a bit more inclusive and welcoming and supportive, those people wouldn't be isolated. But also, if we could find better ways of connecting older autistic adults to other older autistic adults where they're going to find a community and a supportive and welcoming community, then if we could address those massive barriers for people being able to be involved in the workplace and in higher education, then we could keep them more cognitively active as well, rather than isolating them at home. So there's a lot of things that we could do, I think, as a society that would address that. I'm not an expert in dementia, but I do know that we are not creating a community that is really conducive to keeping autistic people physically or socially active.
Yeah,
I would agree, Tracy. I think it is about inclusion, and I think it's about participation, right? As Sandra says, and I think the more we can do to break down barriers and allow for inclusion and allow for increased participation, the better, and in an appropriate way that obviously people feel able and comfortable to do it.
Yeah, I think it speaks to, and also that intersection, because when, obviously we do a lot of focus around aging, and the social isolation that comes with aging is real. And so, yeah, this is something as a society we need to address, and particularly with these more vulnerable groups. Is there any thoughts about, in terms of the workforce, with older adults with neurodiversity, how can workplaces recognise and support people in a better way as people age in the workplace?
Oh, that's a huge question. It's something that I've written a lot about, is around workplaces. Workplaces really are not very autism friendly, which is why we have such high rates of unemployment in the autistic community. So there's the sensory issues, there's the communication issues, there's all the issues around executive function, around understanding the way that autistic people think, the way that they communicate. There's the issues around the fact that we do interact differently, we communicate differently. So there's those social barriers that actually make it difficult for people because there is that lack of awareness, that lack of understanding. So I don't want to sidetrack this because I know we've only got a few minutes left, but there are a lot of good resources around what we can do to make workplaces more inclusive. And I think if we could do that for autistic people at all ages, then we could get them in the workplace, keep them in the workplace, and then that would carry through to older ages. What's happening at the moment is so many autistic people get into the workforce, but when they get in there, they have to mask so heavily in order to be accepted and able to stay in their jobs that they burn out and they leave much, much earlier than they would in a more inclusive workplace. And so by the time they get to their 50s or 60s, they're out of work because they were in such non-supportive workplaces.
I think I'll
But I think maybe just related to that, Tracy, is a better awareness and acknowledgement of the positive benefits of neurodivergent people within the workplace as well. And I think, that is slowly happening, particularly, in the...
Oh, sorry, we lost a little bit of that last sentence again.
Sorry. Just saying, focusing on the positive aspects for the workplace too.
I think that's hugely important across all of this conversation, that we really have to remember that there are so many positive aspects that autistic and ADHD people bring in terms of, attention to detail, focus, honesty, integrity, intellectual capacity. There are so many strengths that don't get talked about enough, and in the workplace, in society, in the community, we focus far too much on the challenges and not the strengths.
Yeah, fantastic. I'm going to just ask one last question. So sorry if we don't get to cover your questions, but they're fantastic, and we'll see what we can look at after. So Anna said, thank you to both Sandra and Mark for this important conversation. Could you please comment on the implications of undiagnosed ADHD, ASD in older adults in neuropsych assessment in hospital when there's questions about decision-making capacity? That's a tough question.
That is a tough question. I think there's two things there where we're talking about undiagnosed or unrecognized. So if I'm not diagnosed, but I am aware myself that I am autistic, then that's a different question. If I am not myself aware that I'm autistic, that's even more challenging, because often that's where we end up with those terrible misdiagnoses. Because if I've gone through my life not realizing that I'm autistic and I'm turning up with these issues that I've probably been walking around with my whole life and no one's ever told me what's actually going on with me, then it's really easy for me to be railroaded into a diagnosis that's completely inappropriate, or to have people question my competency. because so many autistic people, because we weren't diagnosed, we weren't understood, have had our whole lives with people questioning our competency and saying, you can't do this, you can't do that, you know, you're not living up to expectations, you're not capable, you're not competent. And I think you've got a real powder keg there, because if a person hasn't been accurately diagnosed earlier and hasn't understood what it is that's actually happening with them, what type of brain they have, and what the strengths and challenges of that type of brain are, and they don't get picked up until they're in a crisis situation, it's very easily for someone to say, well, actually, this person just doesn't have the capacity to make a decision, rather than actually recognizing what's going on, giving them appropriate supports and supporting them to use the capacity that they have to actually make a decision, which they probably are capable of making with those right supports.
Yeah. If they weren't overloaded and
if we could turn down the sensory overload and we could communicate with them in a way that they could understand, and we could understand their way of communicating, we could give them some power back and enable them to make decisions themselves. Yeah.
And Mark, how might an older person with ADHD present in that situation? Because it is a stressful situation. I'm undergoing assessment in that way.
Yeah, totally. They could present as disoriented, fragmented of thought, distracted, etc., and that could definitely give a wrong impression regarding competency. I think particularly in this space of, mild cognitive impairment / dementia, being able to rule out or appropriately diagnose ADHD in that setting in older adults is really important, and that underscores what I said before about greater awareness within the professions who are, dealing with and treating and diagnosing older adults regularly.
Yeah. Well, I want to thank both of you so very much for joining us this evening, and thank you to everyone who's joined the conversation tonight, and for your fantastic questions that you've put up, and also a really big thanks to the NARI staff involved in organising this event. And we're going to close our webinar there. So thank you.
Thank you.
Thanks very much.